Um, Hi, everyone. Thank you for joining. This is the Wednesday seminar for the Center for Healthcare Policy and Research, otherwise known as CHPR. It's also the Public Health 1 Unit Seminar in the Department of Public Health Sciences. And I believe there also may be some people here who are getting CME credit. So welcome, everyone. I'll start by saying, if you haven't seen me before, I'm Hillary Spindler. I'm the newish Chief of Staff at CHPR. So I might be a new face to you, but you're still in the right place. With that said, I'm very excited to have a talk that's sort of at the intersection of several areas that we work in here at CHPR, that being both the public health space related to nutrition, but also the policy space where there are implications in terms of impacts on safety net programs, nutrition security, and health. And as if this work needed to be more interesting, Dr. Lauren Au, who I'll introduce further in a moment, is also conducting some of it by applying tools that I'm particularly interested in learning more about. So she's harnessing AI related to data in this topic area. So we're very fortunate to have Dr. Lauren Au, who is an associate professor and associate nutritionist at UC Davis in the Department of Nutrition. Her research is at the intersection of innovative dietary assessment, nutrition policy, and obesity prevention for low-income and racially diverse populations. As I just mentioned, her work focuses on harnessing artificial intelligence to improve dietary assessment technology and examining how cross-utilization of safety net programs impacts nutrition security and health. She has a wealth of experience with evaluating nutrition policy changes in the Special Supplemental Nutrition Program for Women, Infants, and Children and the National School Lunch Program. So the title of her talk today is Turning Evidence into Action, Expanding Fruit and Veggie Benefits for Improved Food Security. So with that, I will thank you for being here, Dr. Au, and I can't wait to hear and learn more about your work, and I'll turn it over to you. It looks like it's in presenter.
Yep.
Yeah, okay.
Okay, thank you. Thank you, Hillary, for that kind introduction. Hi, everyone. It's good to be here today. I am really excited to share my research that is focused on the WIC cash value benefit to look at fruits and vegetable intake with higher redemption, satisfaction, and household food security. So I'm going to walk you through a little background about WIC. I'm going to go into some preliminary research that set up this study. I'm going to talk about the findings and how it's tied to policy. So how we took the research findings and how it was translated into changes within policy. And then we'll have some time for question and answer. So the learning objectives today are to go over just a really brief overview of WIC program eligibility and the services that are provided. I don't know how many of you are familiar with the program, but I'll go over just a few brief details before we dive into it. Then I'm going to talk about the first study, which was looking at the alignment of the National Academies of Sciences, Engineering, and Medicine recommendations for the WIC child food package. And we looked at those recommendations within WIC California participants. And then I'm going to focus really on this large randomized trial of looking at this cash value benefit to improve fruit and vegetable intake and food security within California WIC participants. So this is a very brief video to give you a little overview of what WIC does. I checked the sound, so it should be working. like a fun animation. I feel like that's much more engaging way to talk about WIC than hearing from me. But WIC is the third largest federal nutrition program. Um, it changes each year, but around 6 million low-income participants. And as it was showed in the video, it provides nutrition education, a healthy food package, breastfeeding support, referral to other programs. And in the past few years within California, it's transitioned to this electronic benefit transfer card or an EBT card. So similar to how food stamps within now, the same type of card is available within WIC. And this is showing enrollment in the program in monthly participation within WIC from the beginning in 1980s all the way to 2023. The green line is representing children ages 1 to 5. Infants is this yellow line, and then the purple line is pregnant or postpartum women. And what you can see here is, and these numbers are showing in the millions on the left-hand side, is that for children, especially, we're seeing this drop in enrollment for children ages 1 to 5. Some of it has to do with the changes in the WIC food package. So when you have a baby up until age 1, you get a really rich food package if you're breastfeeding, and I'll show you an example, or if you're formula feeding. And so from sort of like a monetary standpoint, that's really advantageous. However, that food package changes over time as a child gets older. And so some participants end up leaving the program. A lot of times we hear from participants that they feel that they're taking a spot from somebody else, even though we know that that's not true, that those that are eligible will receive the benefits, but that's what sort of people believe. So keep this in mind when I start talking about the study, because we're going to really focus on children ages 1 to 5. And again, breastfeeding is a core component for within WIC. So they provide peer counselors, lactation consultants, they have group and individual lessons, and then I've done a lot of work around telehealth, so providing these services through different modalities as well for participants to sort of meet them where they are. This is showing over time how what sort of changes within WIC have been changed to support breastfeeding. Something that might be seen controversial in the program is that they do provide formula. And so, I think over time, they have really done a great job with focusing on how do we still promote breastfeeding, even though we are a program that can provide formula for those that cannot breastfeed or for those that choose not to breastfeed for whatever reason. And so one of the biggest changes was that those moms that choose to exclusively breastfeed get more foods in this enhanced food package. And I'll show you some of examples, sort of comparing the two packages. To put into context the scope of this program, so SNAP or food stamps comprises the largest amount of the USDA budget. Then child nutrition programs lumps together school lunch and school meals. That's the second one. This one is more relevant for post-pandemic, and it was because kids weren't receiving school meals. So this is usually not always here, this PEBT. And WIC is right here. So it's a pretty small amount of the budget, yet it has that 6 million participant involvement. So it is a big program, just not as big in terms of money compared to the other federal nutrition assistance programs. So the first study I'm going to talk about was published in the Journal of Nutrition Education and Behavior in 2021. And this is the study, as I mentioned earlier, looking at, do California WIC participants, what do they think about these proposed changes that are coming to the WIC food package? Are they excited about them? Would they prefer something else? So we wanted to see what were their thoughts around it in preparation that these changes were going to happen. So in terms of some of the changes that have happened in the past, in 1974, WIC became the program started offering this first food package. In the early 90s, the package started encouraging more breastfeeding. 2009, that's when we start seeing more promotion of that breastfeeding food package. And then some other changes that are in line with the dietary guidelines for Americans. So really 2015 was this last change, and that change was pretty minor around yogurt and having a substitution. So this NASEM report came out in 2017, and it was recommending that their revisions be in line with the dietary guidelines. So every 5 years, the new dietary guidelines for Americans comes out, and this report said we should really line our food package with the dietary guidelines. Makes common sense from a nutrition standpoint. But there was a lot of delays in getting this food package finally adopted. So what is in this food package? It includes fruits and vegetables, cheeses, yogurts, eggs, breakfast cereals, whole grain breads, beans, peanut butter, and 100% juice. And as I mentioned earlier, the benefits are loaded automatically onto a WIC card, like a debit card. And there's this component of it that included this ability to buy fresh fruits and vegetables. So usually with a WIC food package, there's like preset cereals that you can buy. There's, preset peanut butters or even sizes of yogurt. But this cash value benefit, I'm going to keep calling CVB, gave a lot of variety for participants. And so that's going to be the focus of what I'm going to talk about. So this is showing two different food packages. I don't know if this really dates me, but there used to be this cartoon where you could look at what was different in the two cartoons. Um, and so I use this picture in a class, but on the left is showing you the food package for someone that is primarily formula feeding, and then on the right is for an exclusively breastfed family. And so you can kind of see, it might be hard to see what's different. And maybe if we can do some engagement on chat, if you could spot out what are some changes that you see between the left and the right, in terms of what are some different foods that you see that's on the right that's not on the left-hand side. So if anyone, more eggs, thank you for Hillary for participating. How about any students that might want to add? Okay, I'm gonna, no more on chat. Okay. I saw Brittany on the call earlier. I was hoping she would chime in here. Oh, okay, there we go. There's just a delay. So canned tuna, thank you. Cheeses, thank you, Dan Tancredi. More bottles. Okay. I think maybe you're referring to the baby food jars. Yeah, thank you. Yes. Thank you. Oh, I love this. Okay. So yes, so you're getting at all of the things. So on the right in the breastfeeding food package, you can see that there's more eggs. You can see that these jars right here are baby food jars. So you get more baby food. You get tuna and you get some more cheeses here too. So there's a significant advantage to promote exclusive breastfeeding. So this study was a cross-sectional survey of California WIC participants that took place right before the pandemic, so 2019, 2020. And it was, it was before their new electronic benefit transfer system was going to roll out. And so we did it in 2019, and we primarily focused on those children 1 to 5, and that they were on WIC. And so we had close to 3,000 participants. The survey took 30 minutes to complete. And our sample was, so mostly we have a really high Hispanic Latino population for WIC participants. So we had 65% Hispanic Latino, 50% reported food insecurity, which is quite high. And the average age for children in the group was 2.5. So what I'm going to show you here on the left is the NASEM recommendations and summarized. In the middle is the question that we asked on the survey about their thoughts related to that change. And then on the right is showing you sort of descriptively how they answered. So if I hone in onto this first one, what are your thoughts on increasing the amount of the cash value benefit for fruits and vegetables? We had about 56% say that it was not enough. So to put that into context, usually in the past, it was $9 a month that participants were given to buy fresh fruits and vegetables. So I just want you to think for a second, like if you went grocery shopping recently, how much you spent to buy fresh fruits and vegetables for groceries. And this was pre-pandemic, but it is so much more expensive. Like I'm just thinking, gosh, my kids love mangoes. Like that could buy me like 2 mangoes for $9. Um, so it's not a lot of money. And then we also, an issue that has been kind of debated is the amount of juice that participants receive. So we had heard from participants that they kind of get too much juice and that a lot of it goes to waste or they don't redeem it. And so we wanted to hear their thoughts on substituting the juice for more cash value benefits because similar to most other policies, this WIC food package had to be cost neutral. So there had to be reductions in some foods to be able to increase the money for other foods. And so we heard overwhelmingly from participants that 91% said that they would rather have more money for fruits and vegetables and less for juice. So this showed us that there was high alignment between WIC participant preferences for what the NASEM food package recommendations were recommending to increase fruits and vegetables, and that efforts to increase the voucher for fruits and vegetables would resonate across all racial ethnic groups within California. And so the new food package came out and it had significant improvements and we were so excited. So it called for an increase in the cash value benefit for fruits and vegetables. It increased the amount of whole grains, reduced the amount of sugar in yogurt, and then there was more flexibilities in terms of choices for foods to respect sort of different cultural preferences. So we were like super jazzed. We designed this study as an original randomized controlled trial. And we were going to do CVB that was going to look at what was earlier recommended at $9 as our control to the $23 per month that was recommended by NASEM. And the $23 amount came out because NASEM said that is enough to buy fruits and vegetables for half of your needs for a month. WIC is a supplemental program, so they were not recommending the full amount that you would need. So 23 was recommended for half the amount of fruits and vegetables you would need. And we were going to assess this over a 1-year period to look at changes in access to fruit and vegetables based on redemption, daily fruit and vegetable intake, food security, and ongoing WIC participation. And so we wrote this awesome study and it got funded by Robert Wood Johnson Foundation. And then the pandemic happened. And we're like, okay, we got to rethink how we're going to do this because the government decided, oh, they're just going to not randomly, they are going to increase the WIC CVB on their own to $35 a month. So they do this during COVID. And we're, okay, that changes our randomized controlled trial design. That's okay. We don't really understand why they chose the $35 a month, but we're going to roll with it. And so what they did was they raised it to $35 a month in the summer months. And then they decreased it. We're just going to focus on the children amount to $24 for that following year. So now we had these different levels. We had a $9 amount pre-COVID, then we had this $35 amount, and then we had a $24 amount. And all while we are, in the field collecting data and figuring out how to pivot our research question. So our original research question was, how are the different levels associated with CVB associated with changes in redemption, satisfaction, household food security, child fruit and vegetable intake. And then we wanted to see, are those results universal or are they different by race, ethnicity, and language preference? So we just had to do sort of a more naturalistic design instead of having a true control group. And so we published these results in the Journal of Academy of Nutrition and Dietetics. We had one paper that was the primary findings looking at the increase in the CVB with food security and satisfaction and fruit and vegetable intake. And then we had a second paper led by one of our students at Berkeley who looked at the changes or differences by race ethnicity. And so this is a very sort of overview of the study design to align with where those changes happened. So we did 3 surveys of WIC children in Southern California. We worked with Los Angeles WIC, who has the biggest caseload of WIC participants. And we did interviews of caregivers as well. So we did these 3 surveys in May 2021 when it was $9 a month. Then we did a follow-up survey September 2021 when it was $35 a month. And then we did a third time point when it dropped to $24 a month. And luckily, we had already done a baseline survey before they changed it. So like kudos for us for the timing of that so that we could see, you know, some of that change in time. But it just goes to show that like you really have to kind of have your collaborations in place and be ready to launch because some things like this can just change on whim. So we looked at the redemption of CVB using the WIC administrative records. We looked at satisfaction with WIC based on survey questions. We looked at household food security using the USDA Household Food Security Screener, the 6-item questions. We assessed child fruit and vegetable intake using the NHANES Dietary Screener questionnaire. And we looked at the likelihood of remaining on WIC if the CVB amount went back to $9. And I just want to remind you that, again, we focused on children 1 to 4 because that is the age group that we're seeing the biggest drop in enrollment. So in our sample, we had 1,770 participants, and our average age was 2.8, so kind of similar to that preliminary study too. We broke down our participants by English, Hispanic, so Hispanic English speaking and Hispanic Spanish speaking. And we've done this in numerous WIC studies. The reason being is that we see such differences in satisfaction in with the program in general. We also see this as a proxy for acculturation. And so we have such a big Hispanic Latino population, so we're able to split it up. So we had a large group there. So I'm going to show you a series of figures that's going to walk you through the overall sample, and then it's going to show you differences by race ethnicity. And the story is that we saw no differences by race ethnicity. So for every time I show you the race ethnicity one, you'll just know that there was no differences. But this is showing the household monthly CVB redemption. So it was $11 on average when the baseline was $9. And the reason why it's more than $9 is because a family could have multiple recipients. And so you could have the mom, you could have the child, you could have 2 children on WIC. So that's where you're seeing this higher number. So before the increase, it was on average $11. It shot up to $41 on average a month when it went up to the $35. And then it went down to $32 when it went to that $24 amount. And again, we did not see differences by race ethnicity. So on the bottom, these are our different racial ethnic language groups. So if Asian, Black, Hispanic English speaking, Hispanic Spanish speaking, other, and non-Hispanic white. And then you're going to see the blue is before the increase, the orange is after that $35 increase, and the gray is that after the $24 increase. So we did not see differences by race ethnicity for redemption. We also wanted to see how much was redeemed. So we can look through administrative records to see, oh, did they redeem 50%? Did they redeem 75%? This is really helpful from a policy standpoint if certain states, for example, are not redeeming as high for certain items, like what is going on there. And so this is really helpful. So here we actually, the redemption was 87%, and it did go down slightly to 85% and then to 86%. And I talked through our WIC colleagues about this, and they said that it's harder to redeem more when the amount goes up, which makes sense, right? Because you're going to have buy more fruits and vegetables. It would be harder to go up. Yes, Dan?
It looks striking, Lauren, the difference between what the average amount in the household was and what the AVC was, or the cash value was. And I wonder if that sort of gives insight into how much it's worth, the hassle of the household making sure that the records are up to date about how many kids are there. Like when it was $9 was the amount and it was 11,
Yeah.
that was like a 22% increase. Well, yeah, I guess it's not too much different. It's a 22% increase versus a 24 to 32 is like a 25% increase.
Yeah.
So
Yeah.
it's not a whole lot different now that I think about it.
Yeah. Yeah.
Sorry about that, Lauren. I was sort
No.
of thinking that once there's more money available, that
Yeah.
sort of makes it more incentive to let them know about the amount. It is the case though that the percentage redeemed, it's just like you said, there's way more money
Yeah.
available, and so you're not necessarily going to see a change in that.
Yeah. And when I talked to them from the policy standpoint, they said what is more important for them is that the redemption amount was stable across time. So that was helpful for me to sort of put that into context too. And again, we did not see differences in the redemption percent by race, ethnicity, and language. So this is asking about satisfaction. So again, thinking back about how we want to promote kids that are 1 to 4 or the parents of kids that are 1 to 4 to be satisfied with the program, to be satisfied with what they're receiving, to stay in the program, because we know nutritionally that there is a benefit the longer that they're on the program. So before the increase, we saw satisfaction with the CVB amount at 7%, which you can imagine. And then that shot up to 76% when it was $35. And then it lowered to 44% when it went down to $24. And the way we asked this was the CVB amount too much, not enough, just right, don't know. And we dichotomized the satisfaction variable into the too much, just right, to look at this versus not enough. And again, we didn't see any differences in race, ethnicity in satisfaction with the CVB. So we did a series of focus groups with our participants, and I think these quotes really illustrate how participants are perceiving the program and what this amount of money is doing in terms of changing their behaviors and what they're buying. So one participant said, things are very expensive these days, so $9 does not go very far for produce. I try to catch all the sales, but it's not just with the inflation and the cost of living or the cost of produce itself. It's that $9 does not go very far. Another participant said, I thought the CVB increase was amazing because we eat more fruits and vegetables. Since there's been an increase, before the increase, we were eating more processed foods, and I did not think that my daughter was getting enough adequate nutrition from eating those types of foods. We also looked at food security. So we want to see a higher number here. So again, this is food security instead of food insecurity. And we did see an increase in food security from 45% at that $9 baseline to 57% during that $35 increase, down to 52% during that $24 increase. And again, we didn't see differences by race, ethnicity across food security during those time points. We heard from participants that the CVB allowed them to buy other foods. And so some examples of that is that I had the option to spend from my pocket what I had available for vegetables to buy meat, buy chicken, buy fish to change my son's diet. So this is having this spillover effect where they're able to use their personal funds for high protein items that they can't get from the WIC food package, but are still nutritionally dense for their children. Another participant said, I think I've gotten a little bit more just in general because of COVID, with the kids being home more. They would get a couple of more meals at school sometime. So I definitely increased the amount of food that we had in the house on hand for them. So again, this was, during the pandemic, 2021. So some kids might have gone back to school, some kids might not have gone back to school, and not receiving school meals was something that we had heard from participants during that time too. So this helped families with high food costs. So they started buying different varieties of vegetables. For instance, we can buy cauliflower every week, and they've been looking up different recipes. And it turns out that other people in my family really liked it as well. So it was about this exposure. Somebody else said, I normally do not buy a lot of fruits and vegetables because the prices are so high, but I was able to do that with WIC this time. So interestingly, we saw that fruit and vegetable intake decreased, and this is not what we had hypothesized. So it went down slightly. The reason why this is significant is it's just because it's rounded here, but it went down slightly. And I want to provide some context to this for what the recommendation is for this age group and to put this into context. So the recommendation for this age group is they were already meeting it at baseline. So our sample of California kids in this WIC sample were already meeting the recommendations for fruit and vegetables at baseline, which is about 2 cups per day for a 2 to 3-year-old child. So they're still meeting it at the follow-up time points, even though it wasn't that much higher than, what we had hypothesized. However, we tried to dig into this a little deeper because, all those qualitative interviews, we knew that things were changing. We just wanted to know maybe what groups was this maybe having more impact on. And so we looked at it broken down by their baseline fruit and vegetable intake. So for those that had less than 1.5 cups at baseline, then it's 1.5 to less than 2.5 cups, and then the greater than 2.5 cups. So those that are already exceeding the recommendation. This dark green bar is showing the difference between time 2 and time 1, so that $35 to $9 difference. The lighter green is showing that difference from $24 to $9. And so what you can see here is that for kids that were consuming less than 1.5 cups of fruits and vegetables at baseline, is we did see an increase in about 1/2 cup at those 2 time points. We saw less of that change at 1.5 to less than 2.5 cups at baseline value. And then we actually saw the decrease in the kids that were consuming already the baseline amount. But also, this less than 1/2 cup for someone that was already having 2.5 cups is still within the recommendation. So I think that's helpful to put it into context. So other quotes we heard was that it gave them more variety. So I was able to buy children different kinds of fruits that they could then try. It opened up a bigger variety because I had more money to give her something other to try instead of what she liked. And then better quality. So I could get Brussels sprouts or something that costs a little bit more. And some participants said that before the CVB, they grabbed the lowest quality. With that $35, they were able to get better quality. And so from a nutritional standpoint, this is what we want to see. Like, we want to see nutrient density in our fruits and vegetables that we choose. We want to see variety. And so to hear this from participants was wonderful. So we asked the question about coming back to WIC. So what is your likelihood of participating in WIC if it went back to $9? And we saw that this was one that did slightly vary by race ethnicity. So the Spanish-speaking group, I also mentioned that they're like usually our most satisfied group. They were the ones that are like, I'm going to come back to WIC if it goes back to $9. But for the other groups, there was less resistance about being as encouraged about coming back to WIC. And then this $35 compared to $24 compared to $9, participants said, I really like the $35, but really anything's better than $9. It was better for meal prep and meal planning. I could get a lot more out of it. It helped cover my vegetables that I needed for dinners and things like that. It provided snacks. And I was able to get that over buying these salty, sugary snacks, or what we hear now is ultra processed foods. And then I'm just gonna go, so we created these community advisory board meetings. So we met with participants and they helped we shared findings with them. They provided recommendations to us of how they would like to see changes with the CVB. And these are just summary of those meetings. So the changes to the CVB amounts were well received. The increased CVB allowed to have more variety and better quality, what those themes of those quotes came from too. The increased CVB amounts helped, but prices also have increased during that time. And that increased CVB amounts have helped offset other household preferences or expenses. So that example with like buying meats, being able to use your personal funds for more expensive food items. And that the participants really appreciated having texting as their form of communication through the study period. So we did a series of policy briefs with our partners at Public Health Foundation Enterprises WIC to show how the CVB bump may have impacted produce purchases in 4 months. So we showed that within the LA area, it could have contributed to about $10 million in increase in produce purchases, which translated to approximately 50 million within California to 400 million within the US. And this was part of these policy briefs that we circulated with stakeholders. This speaks very well to legislators in agricultural areas that may produce fruits and vegetables. So showing sort of the numbers was really helpful. So for this study, we found that the augmented CVB led to higher CVB redemption and higher household food security. That satisfaction increased with the higher CVB amount. Fruit and vegetable intake increased for those children that had the lower baseline fruit and vegetable intakes, but not overall in our sample. And that the participants indicated that the increases in the amount and variety of fruits and vegetables provided to children provided more personal funds to be able to use for other grocery items for their children. So we had a couple follow-up papers from this work. We wanted to look a little bit more into how it impacted differences in that diversity of fruits and vegetables redeemed. So this paper was published by my colleague, Chris Anderson, who's now at University of Tennessee. And he created this really cool like fruit and vegetable redemption calculator for this paper. And then my PhD student took it a bit further and looked at how it contributed to the diversity in dietary guideline recommendations for fruits and vegetables to make it a little bit more applied for nutrition folks that are in the field. So we did a series of talks with the media and policy briefs, and one of them was with LAist, which is the LA NPR. And Shannon Whaley is my colleague, who's the director of PHFE WIC, where we were interviewed for this piece, talking about the importance of the fruit and vegetable voucher program and how the benefits were going to run out. And this combined with not just the work we did in California, but across other states during that time, led to the permanent increase in the WIC cash value benefit across the nation. And so this was adopted earlier last year, and this was so exciting. They adopted it at more of that $20 level. So it wasn't that $35 level, but for children, it was closer to the $20 level. And now we're at this time where WIC in general is under fire. So many of you know that we are in a shutdown, and WIC is a discretionary program. So they need appropriations from Congress to be able to meet their caseload. And so what has been going on is that we have the House bill and we have the Senate bill. The House bill caused this cut to the WIC CVB program. The Senate bill remained that WIC CVB higher amount. And so there is communications that it's going on. There's a lot of advocacy that's going through National WIC Association and other groups to try to preserve that increase that was just passed into law. So we will see what happens. And with that, I'd like to thank my collaborators and take any questions from the audience.
Thanks. That was fascinating. I have questions, but I also see Daniel Tancredi has some questions, so I'll let him go first.
Hillary, you should go first. I've already been yapping.
I have a lot of questions, so I'm gonna try and narrow it down to one. Good job rolling with the times. That is wild. Just the changes in your time points and that you had a baseline and you guys adapted like that. That's awesome.
Thank you.
Did you say all the interviews were in LA?
Yes.
Okay.
Yeah.
Okay.
Yeah, and that was one of the changes we had to make too. You know, we had originally planned for within all of California, and we recruited different counties to have just more diversity of the sample, like more rural. But when COVID happened, we had to make changes really quickly. And because my partner was based in LA, that reach was a lot easier for them. So that was one of the changes that had to be made.
Yeah. And those interviews took a while. You did so many of them. How, like, did you have a good response rate or was that?
So yeah, this is a great question. So I think what really helps with working within a WIC or any community setting is having that contact, that point of contact that's within the organization. So we work with one of their WIC staff who helps administer all of their studies. So she has such an amazing relationship with the participants and is able to recruit participants for us for any focus groups, is able to get really high follow-up numbers. And that is completely valuable. I was just talking to a coworker yesterday who said that years ago they had tried to do a study within WIC and they had a huge issue with getting participants. And I think a lot of that was, you know, their strategy in terms of how to engage participants. But I think if you don't go through the organization and kind of bring in a study from the outside, then it is much harder.
Okay, fascinating. And I'm guessing you guys, you did this, but I didn't see you present on. I was wondering what the income threshold for WIC is, and if you broke things down and like stratified that way, the way you did by race.
Yeah, so the income qualification is 185% of the poverty level for WIC.
Okay.
I don't think we did it broken down further than by group. We haven't explored that yet.
Okay, Dan, go ahead.
Lauren, it's great seeing how your research has evolved. I'm wondering, do you have any thoughts, or have you or Shannon thought about whether or not the increase in the cash value benefit could improve the food environment? Like, I don't think you guys have done any food environment assessments to see if produce is more readily available. I know from some of my other work and colleagues that it's very difficult in certain neighborhoods to try to make a variety of fruits and vegetables available and know that you can sell them and make money off of them before they go bad.
Yeah, that's a really great question. And it ties to this earlier meeting that I had with our WIC colleague so this survey that we did, that was the preliminary study, they try to do these yearly WIC surveys within all of California. And they have one that they collected in 2023. They have ones that they're going to collect in 2026. And what they are able to do is now they're able to geocode WIC vendors. So if you were to go to a WIC store, we're able to see where those WIC stars are in relation to where those participants are, which is amazing. I can't have access to that raw data, obviously, for confidentiality reasons, but we're going to work together to look at similar to your question, maybe not related to the CVB, but that is something to consider. We're going to look at more of kind of, changes in redemption of the food package as a whole and in proximity to WIC vendors. But I know because we have the geocoding that we could look at some of the other indices, like the Food Atlas, for example, that has a marker for like grocery stores. It has a marker for fast food outlets, for example, where we could also look at that with redemption or, other administrative data that we have access to.
It's striking when you go to some of the grocery stores, like there's San Miguel, like just down the street here from UC Davis Medical Center, that has a really diverse produce selection. Whereas in other neighborhoods, where lower income neighborhoods, the produce available isn't that varied, like.
Yeah, I don't think we would be able to get at that granular level unless if we
Okay.
were doing some type of food environment surveys of looking at the food environment. But I think we could get at these proxies for fruit and vegetable, or like proxy, for grocery stores.
Yeah.
Yeah, but that's a great suggestion.
Any other questions from the group? I haven't.
I would just add that, Lauren, what you're doing is very important. Like some colleagues and I looked at addressable barriers to good health. And the thing that causes the biggest burdens, like the most lost disability adjusted life years, is poverty. So any kind of thing that makes healthy food available or things like that is going to have like major impacts. So.
I think one thing that was I don't know how many students are on this call versus faculty versus like which career stage folks are at, but this study was really eye-opening to see how I was a co-investigator, so I wasn't the PI in the study. To see how the lead PIs handled this pivot. And I think everyone was navigating COVID and how they were changing their research and adapting to it. And so from a more junior standpoint at the time, I really appreciated that example of seeing role models, figuring out how do you take a study that you had put all of your heart into writing, and how do you change it but still answer the questions that you want to answer. And I hope we don't have to go through another pandemic, but if we have to in the future, it's just something that I know that I'll sort of tuck away for, okay, this is how we can still move forward.
That's great advice. I know you mentioned about kind of the current federal state with this program, and it sounds like the House had voted to cut, and the Senate has voted to maintain, but it's discretionary and still sort of up in the air. How does the MAHA movement, like, are they supportive of WIC, or what is kind of the federal landscape?
Yeah, that's a
I
really
mean that like in a totally ignorant way. I can't.
Yeah, no, that's a really great question. So just random anecdote is that the New Yorker, so I do work within WIC, but I also have done work within school meals. And the MAHA movement is really in nutrition right now, right? There's like this big talk about ultra processed foods. And I just was in an interview with the New Yorker about school lunches and sort of changes that they're proposing to school lunches in response to this MAHA movement. And I think similar to other areas, there's a lot of talk about, oh, we want to cut ultra processed foods, we want to offer whole foods, but what's actually happening to administrative staff and what's happening to the programs themselves is that they're getting cut. So like there's a disconnect between what is being said and messaged versus like what's actually happening. And within WIC, the biggest concern is that if this shutdown goes longer, is that they are not going to be able to serve families. And this has never happened. Like the shutdowns in the past have never lasted long enough where they had to stop, issuing benefits and seeing participants. And so that is the huge concern. So there's a lot of advocacy right now to just talk about preserving the funding for WIC, like coming to a bipartisan solution. I haven't seen as much around MAHA and WIC specifically, more around MAHA within nutrition as a whole, like this really big push around ultra processed foods, this push around dyes. But again, there's this big disconnect of, there's this big focus, but I was just on this call too, where they're taking away the food security surveillance for the whole country. They're just like stopping doing that. So there's, it's like we're saying we need to do one thing and we're focusing on this area, but we're not seeing sort of the big picture and the importance. And so I don't know what's going to happen in terms of sort of like the MAHA on within WIC. But for the most part, WIC has always been a bipartisan supported program because it has this focus on pregnant women, postpartum women, young kids, and children, and because it has that healthy food package that people can say is like a sort of a prescription, like a nutrition prescription, which is supported by both sides. And I saw Dan put into chat something.
Well, Lauren, WIC is interesting from a history of welfare standpoint, just going back, centuries. It's sort of historically popular to take care of women,
Yes,
infants, and children.
right.
And that was sort of the original motivation for a lot of social welfare programs. What I put in the chat was just an interesting idea that the Trump administration had yesterday, that they were going to try to take some of the tariff revenues and use that to sustain WIC. Whether that's sincere or not, who
Right.
knows? But it sort of indicates sort of how taking care of women, infant, and children is sort of, popular across the political spectrum.
Mm-hmm. And I just put into chat too the article. It's related to school lunches, but it was a really comprehensive piece about what the school lunches, what policies within school lunches are being targeted within this MAHA movement right now.
Thank you. I can't wait to read that. It's like cool that you're in the New Yorker.
Yeah, it's a little nerve-wracking too when the fact checker calls you and you're like, did I say this? Yes, I did.
I'll give it one more minute if anyone else has a question or anything to add.
I just like these emojis that are popping up.
So fun.
Yeah, if there's no other questions, thank you so much for inviting me. This has been really fun.
This was great. And you didn't use any AI for this.
No, I didn't
Okay.
use any AI. My AI work is like completely different. It's using AI to do dietary assessment. So we have a mobile app that's taking pictures of food and calculating nutrient intake. And that study started in April, but we're actually going into the field at the end of this month. So that would be completely different research, but super fun.
Oh, cool. Okay. Maybe you can come back and tell us in a few years about that. Thank you so
From a
much. Oh, go ahead, Dan.
from from a portion control standpoint, that would be kind of amazing because people don't really know how much food they're eating, and so they
Yeah.
think like when my mom from Ireland growing up in the Depression, a portion was like way bigger than what a nutritionist would call a portion.
Yes.
Yeah.
Yeah, and that is honestly like one of the hardest things to do AI with is the portion
Yeah,
estimation because it has to reference like the size of the plate or the depth. But we are getting some good metrics back from that. So yeah, if you see us in the
cool,
dining commons in October, November, that's where we'll be.
awesome.
Fascinating. Yeah, and then with Ozempic and all that stuff. I know that's not what you're talking about, but it just adds it's like a pandemic wrinkle to the
Yes.
food portion. Okay, thank you everyone for joining. Thank you, Dr. Au. This was fantastic. I really enjoyed it. Um, Take care and have a
All
great rest
right.
of your week.
Thank you.